Hello, y'all. Welcome to BirthFit podcast, episode number 264. I'm your host, Dr. Lindsey Matthews Cantu, and I'm about to wrap things up for I spend one night away a month right now at a hotel, and I get lots of work done and lots of sleep. So I feel really good when I leave. But this is my last bit before I close the computer, head back, and I'm fully present with the fam. Okay, today we're going to be talking about exercise and our prenatal program. Before we dive into that, I want to remind you, please go to our nonprofit.birthfit.com and donate. We are in need of funds, and we support those women that have active duty military husbands, or maybe they were active duty at some point. We support them with a birth doula or a postpartum doula. So go check it out. Let us know if you have any questions. All right, let's dive in. I haven't ever done, I don't think, an episode on exercise, so we're going to chat about it here. And as you know, the episodes right now are short, sweet, to the point. So if you are a coach, a practitioner of some sort, this is going to be a great episode to share with anybody that's like, I don't know, is exercise safe? What are the benefits? They're still living in the freaking dark. Y'all, exercise reduces cesarean risk by 34%. Period. I'm just going to put that out there. I think majority of the population knows that exercise during pregnancy is beneficial. Um, in fact, I've had so many women come to me, both in person and for virtual programs, that are like, I know I need to work out in pregnancy, but I don't know what to do. I love that because when I first started, that was not the case. People still thought strength and conditioning, training during pregnancy was dangerous, and prenatal yoga was the only way to go. Um, in fact, living in LA, it was Kundalini yoga was the only way to go, or something like that. Gosh, what was the old yoga place that was there? It's like Golden Bridge, or I can't remember. Anyways, they had a full prenatal class all the time because that's the only thing doctors recommended in the area was prenatal yoga. But I think for majority of the population, they get it. They know they need to strength train. They know they need fitness during pregnancy. Prenatal exercise reduces the risk of cesarean by up to 34%. And that is according to a 2025 meta-analysis of 16 randomized controlled trials. That's not supplements. That's not just stretching. That's not a pelvic floor exercise or app. It's not, what else is out there? It's not these random shit things that influencers promote. Y'all, it's just exercise. And that's mixed aerobic and resistance training. So that's strength and conditioning training. That's BirthFit training because we do general strength and conditioning. That's the kind that actually moves the needle for prenatal mental health, birth outcomes, and postpartum recovery. So thank you for that 2025 meta-analysis. Hello, BirthFit. We've been around since 2013. Um, I'm going to plug BirthFit. Here we go. BirthFit's full-term prenatal training program starts at week 5 and takes you through week 42. Y'all, we've updated this. We update this continuously. We update it like almost every 2 years. It is now delivered via an app. To get the BirthFit app, you have to be enrolled in one of our programs, but it is so user-friendly, digestible. You have little videos there. Anyways, I don't think it could be any easier. I should say simpler. Is it more simple? Yeah. Okay, so inside the full-term prenatal training program, you get 3 to 4 training days a week, depending on what's going on. And I'll say 3 training days a week plus one for sure zone 2 active recovery day. There's core and pelvic floor prehab built into every session. So you learn the BIRTHFIT basics, which are 15 movements and poses that are based on developmental kinesiology, functional movement, functional range conditioning. Yeah, in short, the BIRTHFIT basics are movements and poses that every human being on earth should be able to do, no matter the season of life. Yes, there's going to be adaptations depending on if you're recovering from a shoulder surgery or third trimester pregnant, but you get the idea. These are basic human movements. They show up in the prehab of every training day. Our program is strength and conditioning and movements designed to prepare your mind and your body for birth. Workouts, the training session, are designed to start getting you mentally prepared, physically prepared, emotionally prepared for labor and delivery. We don't know how long birth is going to be. It could be 3 to 4 hours. It could be 3 days. But that's why we do different style workouts, different length. Um, we keep it constantly varied. We use minimal equipment. So this was a big feedback after the very first iteration of our BIRTHFIT training program. Moms kept coming back to us for their third, fourth, fifth, sixth, seventh pregnancies. That's what I've heard, because they loved how their body felt. However, they were short on time, right? Now you're putting it together because they had littles, they had toddlers. So we needed to keep it short, shorter, intentional, and minimal equipment. So all you really need base level equipment for our BIRTHFIT prenatal training program: dumbbells, maybe like 2 sets, a heavier one and a lighter one, kettlebell, and 2 super bands. Beyond that is bonus. So if you have a barbell and you're like first time mom, chilling with a barbell, all the gym equipment, cool. But then as you go through the motherhood season and you're having your second, third, fourth, you realize a barbell might be a little hard to do, especially with you trying to get the workout in with littles running around. Um, and like I said, we have a user-friendly app, and each training day, excuse me, has about 2 to 3 demo videos and community chat access. We also have a once a month office hours support session where you come and you can ask questions about your particular case, ask for movement modifications if you have not got those prior, just to meet other people inside the community. Anyways, if you are looking for a program, this is not just a generic pregnancy safe modification. This is a program that is intentional. We are in season preparing for labor. We're not just maintaining fitness. We are intentionally, doing our best to build strength, to enhance mobility, to enhance endurance and stamina and balance, y'all, balance. So this program's for you if you're looking for that. If you're looking for evidence-based over fear-based restrictions, if you're ready to invest in your foundation, if you're ready to invest in your health and your baby's health, no better time than now. So the prenatal training program, y'all, there's all kinds of information about fitness, prenatal fitness. One of my favorite books, it's coming out, like the research is coming out. We can geek out on it all the time. But the one of the first books, 2 books, I'll share these, that like I could find that really um shared the benefits of fitness was Exercising in Your Pregnancy or Exercising Through Pregnancy by Dr. James Clapp. Um, I think that was in the 80s. It talked a lot about conditioning, like aerobics. And then active birth. So that wasn't really exercise related, but it talked about movement during birth. And Janet Velasquez is the author. And that was a really great read for me. And like kind of marrying the two made sense. Um, and then now we're finally getting into strength training and research is coming out. And one thing I want to share with you is the emotional side of things. So prenatal exercise reduces risk of depression by 38%. So I mentioned earlier, decreases cesarean risk by 34%, depression by 38%. And this is based on a meta-analysis of 52 studies. Exercise-only interventions significantly reduced prenatal depressive symptoms. Y'all, that's amazing. Your mental health during pregnancy predicts postpartum. And you want to know the dose that worked? Approximately 150 minutes a week of moderate intensity movement equals a reduction in depressive symptoms. That's pretty cool, right? So if you think about it, our sessions are anywhere from 35 to 45 minutes, and we got 4 of those a week. Nailed it. All right, and then strength over cardio for mental health. The meta-analysis showed that mind-body formats, yoga, tai chi, mixed aerobics, and resistance programs had the largest effects on depression and anxiety as compared to pure cardio. Pure cardio had smaller and they were less consistent. I share this about mental health. Why? Because baby is a hitchhiker on mama's nervous system. If mama is depressed, if she is anxious, dysregulated, baby is going to feel that, y'all. Exercise helps regulate mama's nervous system, which improves baby's health in utero. Pretty amazing, huh? All right. One thing I want to share, this is like my little, I say this a lot, and for those of you who've been around, you're probably tired of hearing me say this, but the fitness pillar is the gateway drug. It's the gateway to discipline, accountability, ownership, sovereignty. It starts with gym stuff. Why? Because I really think when you can feel it in your body and then you can see it, but you got to feel the thing in your body. And like that's what's going to move the needle for discipline. And discipline ultimately leads to freedom. Um, so we talk about, having a sovereign birth experience. And what I mean by this, for those of you that are new, a mother-led birth experience. You can't have that without radical responsibility, without extreme ownership. And, that sounds daunting for some. Okay, but let's back it all the way up. Let's take a pause and start with small, something bite-sized that we can do. Can we show up for ourselves once a week in the gym? Can we keep that appointment? Can we have integrity with ourselves? Keep that appointment um, across the board. That's where I'm going with that. All right, and to close things out, remember in the beginning, I mentioned that 34% reduction in cesarean. Let's add to that 14% higher rate of vaginal birth, lower risk of gestational diabetes, lower risk of prenatal hypertension, a 38% reduction in prenatal depression. I just said that. For baby, healthier outcomes across the board. Reduce macrosomia, so big baby. No increased risk of preterm or low birth weight. So there's a healthier body composition and usually a full-term baby. Better fetal cardio function. This is exercise, y'all. This exercise is actually protecting baby in utero and beyond. So some long-term benefits. Emerging research has shown that women who exercise pregnant set their baby up with better neuromotor development, lower rates for obesity later in life, and a better cardiometabolic trajectory. Mom's metabolic health in utero matters. So let's just right now debunk the myth that exercise is risky while pregnant. It's not. The research is clear. Moderate to vigorous exercise is necessary. And we talked about the dose. But y'all, early on in my career, and maybe because people know who I am a little bit, they're like, oh, that's the BIRTHFIT lady. But I'm not seeing it as much as, um, right? Women are realizing exercise is beneficial. I think even practitioners are realizing it. Um, but pregnancy is not a fragile state. So let's get women moving during pregnancy, huh? And let me see if I want to add anything else. Oh, let me add this quote. This is really good. I posted this on social the other day. In human cohorts, higher maternal physical activity during pregnancy has been associated with better global development scores in infancy, lower risk of abnormal developmental screenings at 1 year, and higher IQ and language scores at 5 years. That makes me happy, right? All right. That's where we're going to wrap. If you need anything else from me, let me know. Join the waitlist for the BIRTHFIT certification fall cohort on our website. In the meantime, join the BIRTHFIT community membership. This is where coaches, practitioners, mothers all have a seat at the table. We have weekly calls, we have a resource library. You get discounts on all the training programs. So I hope to see you in there. Have a great week.